Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Hello, everyone, and welcome to another episode of I Am You. Today, I have the privilege of having Miss Deb Gossell with us. Deb has a very interesting story to share with us about her journey in the healthcare and how sometimes medical conditions can be mistaken for other problems. Deb, welcome to the I Am You podcast.
Thank you.
I'm so happy to have you here. Thank you for allowing me to interview you today and for allowing the audience to be part of your life as you share your journey through the healthcare system. Deb, when I met you, that was a few years ago. You came into the practice to establish you already had experience with cardiologists before you met me because you were diagnosed with an electrical system problem of the heart, which was your atrial fibrillation.
Right.
So that means that you've been taking care of your heart for a little while.
Yes.
You started early, a little earlier in your life with medical problems.
Right.
But it was not as simple to you as sometimes is when it comes to cardiac problems. Fast forward after a few years of caring for you, you started developing symptoms of passing out. And you came to me and you shared a story when your husband had to catch you and you have no clue of what was going on. You want to share with the audience of what was it that you were experiencing so they have an idea of what the symptoms are so when we go through the diagnosis they can relate.
Okay. Well, my medical doctor, Dr. Toro Galarza, diagnosed AFib because I was having problems even falling asleep. And then I met you and you put a heart monitor, not the permanent one, on me. And the company that calls me at 3 a.m. the same day and said, "Are you up exercising or anything?" And I said, "No, I was asleep." And so that kind of pretty much started the AFib, which I went up under your guidance to the Cleveland Clinic and had a surgery for that. And then I had to go back because I really had severe AFib. And it took 2 ablations to get it where I still have AFib, but it's not crazy. And so started taking meds for that. And then about a year and a half later, the first time I passed out, we were with friends at a very nice restaurant. And I stood up to go to the restroom and I hit the floor. And it was Friday night. So I say I was the floor show. Paramedics came. And, I am a retired speech therapist that worked with severely handicapped 0 to 5. So I knew the symptoms of a stroke. And it wasn't that. I did my own
You were doing your own assessment? As you were there, you're like, okay, can I speak? So is my facial droopy?
Yeah, I stuck my tongue out and did all the movements. My husband, of course, he's a retired pilot, thought I was weird. But I then later explained. So I didn't have to go to the hospital, but then I had a couple more at home. And one time he caught me when I was starting to go. And, it's made me frightened to just pass out because occasionally I remember while I'm falling, but before that, it was just like hit the floor. And I still make him walk behind me when I'm going upstairs because I'm afraid I might still pass out.
Were you having any warnings that you were going to pass out?
No. It would just happen. And, I have chronic pain, so I take an opiate couple times a day, and I still drink a glass of wine every evening. My husband thought it was a drug alcohol interaction, and he wasn't very comforting, and I knew it wasn't. So you and I started working on it. You put a cardiac loop in first, and like the next day, I get a call from your office saying, "Oh, we need to put a pacemaker in you." And I mean, the next week, I was in and you were putting a pacemaker in.
So I'm going to go back real quick for the sake of the audience to listen to that part when you said, well, I take medication for pain.
Yeah.
I also have a glass of wine at night, and sometimes it can be assumed that what you're experiencing is episodes that you're passing out because you're mixing medication with alcohol. No, and you say, well, my husband was under the impression of that, and kind of like assume that was the case, perhaps a little upset about the fact that you were doing that. No.
Yeah.
But, and although we know that sometimes that could be the case, in this case, when you came and mentioned that, we're like, okay, we need to understand what is making you pass out rather than assuming that it was actually a mix of those drugs. No. And I love it because with you is being that easy or quick when we say, we suspect this, let's put that, and then you said next day, 2 days, they found out what the problem was. No. So in this case, for the audience to have a little bit of information, an implantable loop recorder, which is what we put on you, is the little device that goes under the skin. And when we choose to do that for our patients is when they're having these sporadic episodes of, in your case, was passing out. You can never predict when somebody's going to pass out.
Right.
And if a doctor put an external monitor, like the initial that we put in you when we found the atrial fibrillation, you might not even find out the cause of the patient syncope, which is the medical term for passing out.
Yeah.
So sometimes patients like you, the women that are listening to this podcast, might be experiencing similar symptoms. They have them wear a monitor and they see nothing and they say, well, it's not your heart. And then your story is the perfect story of, well, you never can predict when the syncope is going to happen.
Right.
You never know when you're going to be able to capture what is happening with your heart. So once we know that, then the implantable recorder, the value is that it lasts, the surveillance lasts longer, the battery life is about 3 years, and we can be looking at that heart activity, the electrical activity of the heart. In your case, it was so obvious that immediately the device captured pauses in your heart, meaning heart stopped beating, and then that's what you got a phone call saying, oh, your heart has shown that it has the capability of going flatline for a certain period of time, which at that point, we put one and one together and say, well, this is definitely one of the reasons why she can be passing out. Now, what happened after that?
Well, I got the pacemaker, and we'd worked with my neurologist, and he said it wasn't my brain. So we were continuing working on finding out what was causing me to pass out. And I got those spots on my arm. I'd never had really high blood pressure, and they're big purple. And we went to a walk-in clinic. They immediately sent me to the hospital, and I spent the day there trying to get my blood pressure down. And they scripted some meds, and then you kind of didn't like that med, so you changed it. And now, I take my blood pressure pretty regularly, but it's always good. And, I just thank you. I really think you saved my life.
I think that it is my honor because that's what I'm here for.
Yeah.
I'm here to serve my community, to serve my patients, but more important, women like you, where sometimes they are in a journey where it's hard to understand what is going on with them. And then I like not to take anything for granted and always have that curious mind of what is happening in there, We put a pacemaker in you, and now we ensure that you have a proper heart rate. And then later on, you started having problems with dizziness. And then that was now related to your blood pressure.
Right.
So then now it's another problem, no?
Right.
So, but the major issue of the passing out situation where you had to leave scared, like you just shared with us a few minutes ago, like I still have my husband walk behind me just in case I pass out, even though that has not happened.
No, it's been about 1.5 years since I had my last pass out. Mm-hmm. And, it's funny. He's kind of a stoic guy, and he's never apologized for saying I was drinking and taking an opiate. But one of his friends got exactly the same thing I do. Oh, poor Mike. And I'm thinking, I wanted to kill him.
Perhaps because after the experience that he went with you, he realized, it could be a real thing. Yeah. No, I don't know. I think there's a combination of things. Now, which happens also for us in the healthcare as well.
Yeah.
No, the longer you spend time with somebody, the less you listen to them. No, it's kind of like, it's like, I think that's a spouse syndrome. It's like, oh, here he comes again with the same complaint. Or here she comes again with the same complaint. No. And for you, important to recognize that even though he did not apologize to you about the fact that, oh my God, I'm sorry that I assumed that it was this thing, but you really have a real cardiac problem that if we corrected it like we did, then we no longer had to worry about you passing out or a major life-threatening situation. At least in your heart, which is more important than anything. And for the women that are listening to us, it's about you. Yeah. You did not settle for the fact that, no, this is not just a combination of my alcohol and opioids. And I'm pretty sure that for you was like, I've been doing this. Like, why all of a sudden I'm going to be passing out now?
Exactly.
And those are the things. And then also continue to advocate for yourself because you know that there's something that is not right.
Right. Really what helped me is, I used to work with severely handicapped children, and it was a puzzle. And I was part on the diagnostic team figuring out what was wrong with them. And, I've just always been that way. And my son was born at 24 and a half weeks and a pound and a half preemie. And so I've had to be his advocate very strongly. I'm just blessed that he made it because he was born in 1984. And he only has 2 mild disabilities. So, I feel blessed with that, but it was constant.
Advocating.
Yeah, advocating, yes.
Constant believing, constant, no, we're not going to settle for that. No, I know that he can do better. I know that there's resources out there. But you know what? I'm super happy that you mentioned this because so many of us as caregiver focus a lot on others and we advocate for them and we look for opportunities and resources. And then when it comes to us, we don't. But you, in the other hand, that was actually for you and for him as well. No, it's like you continue to speak up and continue to express how you were feeling. A few times you called the office and said, I think I need to be seen. Yeah. It's like you're listening to you, to your body, to what you need. And if you were to refer to the audience, that the women that are listening to this podcast today, what would you say to them in terms of that advocacy?
Right. Well, I think you need to read your body, and everybody can do that. You just have to think about it. And, you only have one life. So, you need to fight for it.
I love it. That was awesome. You only have one life. We have this opportunity. We only have one heart.
Yes.
And if we do not do it for ourselves, who is going to do it for us?
Yes, exactly.
That's amazing. Well, Deb, I really thank you for coming here today.
Oh.
I appreciate that you open your heart to our audience, and I love the fact that you're an advocate for you, for your family, and for the women that are around you, because I know that there's no friend around you that you don't make them get checked.
Oh, yeah. And I mailed out your book, Heels versus Ties, to my 2 daughters, because they're in their 40s, moving on to 50, and then a few of my friends. And I said, women's hearts are different than men's.
That's awesome. That was another way of advocating for others, no? And I really appreciate you that you are being a force for change as well with our women in the community.
Yes.
And because this takes a village, no? So that's what we're here. Well, that's why are we sitting here today? No, it's like, besides the book, what else can we do to spread the word so women understand that we're different and that we have to continue to advocate?
Right.
So I thank you.
You're welcome.
And this takes us to an end of another episode of I Am You. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.